Welcome everyone to the Conference Board's new series of webcasts called Beyond COVID-19, Insights for What's Ahead, where our experienced panel of experts at the Conference Board focus on topics that are most relevant to you, our business partners, and as we deal with this crisis, this healthcare crisis currently, the COVID-19 crisis. Members of the Conference Board have had exclusive access to these kinds of conversations with business leaders focused on key issues around the recovery. Plus you have an opportunity to ask questions, and today in this webcast we have a chat function activated, and we would encourage everybody to ask questions as we go, and we'll try to weave them into the broadcast today. As you come to expect, the Conference Board is uniquely positioned to provide the C-suite with a 360-degree review, complete view of the implications for business from the COVID-19 virus and insights for what's ahead. But you can also access all of our information on our website, conference-board.org/COVID-19. Moving to the next slide, I'd like to introduce everyone. We are starting off our series now with a great guest today, and that's Dr. Stephen Miller, who is the Chief Clinical Officer of Cigna Healthcare. And we will talk about the healthcare challenges and how the system is responding to COVID-19. Dr. Miller is a member of Cigna's executive leadership team. He is a renowned expert in the subject and has been leading the response from Cigna on COVID-19. Dr. Miller, welcome.
Thanks for having me.
And I'm also joined by my colleagues, Dr. Bart Van Ark, the Chief Economist of the Conference Board, and Dr. Lori Esposito-Murray, who is President of the Committee for Economic Development, which is our public policy center at the Conference Board. Welcome to both of you.
Thanks.
Great, and just again, provide your questions in the chat box as we go, and we'd like to hear from everybody. Now we can proceed to the next slide. You know, it just seems like so long ago, but it was really only 3 weeks ago that our economy was humming, growth was strong, we were at virtual full employment, and the world felt like a safe place. But this thing called the novel coronavirus, or COVID-19 as it's begun to be called, has began percolating in China, and even that was far away. But in 3 short weeks now, we've gone from what some might consider an idyllic economy to an abrupt, brutal, full stop. So the US and most of the global economy has been shut down in order for people to shelter in place, self-quarantine, and wait out this storm. You know, it wasn't a nuclear attack or a meteor hitting the earth or any of the other kinds of things that we see in movies and you worry about that caused this. It was this tiny little bug that none of us can see that has been so devastating. To date, as this slide shows, we've got over 1.3 million people around the globe that has now almost 1.5 million that have been sickened, and nearly 90,000, unfortunately, have died so far. And in the US, there have been over 300, now over 400,000 people sickened and almost 15,000 deaths. So a devastating illness. Next slide. State shutdowns have taken nearly a third of the US economy offline, and over 10 million people, and as of this morning, over almost 17 million people have become unemployed just in a matter of weeks. So GDP is projected to plummet up to 15% negatively in the second quarter, and maybe as much as 6 to 8% negative for the year. We'll talk about all of this, but as you can see from this slide, the virus is projected to peak in the US in a couple of days, but you know, this curve doesn't completely exit until sometime in the summer here, and unfortunately it has resulted in a vast number of deaths. So moving to the next slide, the key issues that we want to address today is: what is the track of this virus going to be? How will the US healthcare system handle it? What are the best and worst cases from an economic projection? And then finally, what should be the public policy actions that our governments should take? So let's move to the next slide, and I'll welcome Dr. Miller. Dr. Miller, Cigna has been at the forefront of this virus and was the very first healthcare company to jump in and to say, we're going to take care of our customers, take care of our patients, we're going to provide free co-pays, eliminate all the costs of treatment. And from my standpoint, Dr. Miller, Cigna is a true hero company. And you are also a global company, and you dealt with Wuhan at the outset and so forth. Talk to us about how you've seen this virus erupt from Asia and how you see it developing.
Yeah, Steve, so thanks for having me, and thanks for everyone who's on the Zoom today. At Cigna, we've actually been dealing with this since January. We have 1,500 contractors in Wuhan that work for us, but are also our largest non-U.S. healthcare entity is in South Korea. So we've actually been tracking this from its very origins in Wuhan through South Korea to our affiliates in Europe and Asia. And so we've actually been standing up and running a COVID command center for a long time. And as you can see, this is actually swept across the world in a really fast way. And we believe that we have to be just as innovative in what we do as the pharmaceutical manufacturers are if we're going to bring this to a halt. And so in the United States, as you've recognized, we were the first to actually make sure that patients had access to testing by eliminating the copays. We've eliminated the copays for our members when it comes to treatment. So we really believe that working together with the entire healthcare system, we can actually make a big difference. And what you see on this first slide is that we're in the exponential growth phase of this outbreak. If you look at the time it took to go from 100,000 cases, which is where that number one is, to 200,000 cases, it took about 67 days. The next 100,000 were in 14 days, and now we're adding over 100,000 patients every day worldwide. And so we are growing at a tremendously fast pace. And as you know, the deaths lag this by a little bit, but as you identified, in the United States, our worst days are ahead of us. We should actually peak in the next few days as far as new cases. And that's because if you go to the next slide, what you see is that shortening social distancing is making a difference. You know, what we all need to do from a public health standpoint is we need to flatten the curve, and you all have heard about this a lot. But when we talk about flattening the curve, I really want people to understand what you're trying to do is not so much protect yourself, is you're protecting each other. We're keeping the volume of patients that are going into our hospitals and going into the healthcare system down so that we can actually deal with them over time. And so many, many countries have put this type of social distancing in place. And if you go to the next slide, what you see is it actually works. So you can see you can actually bend these curves. So if you lock down, you minimize social distancing. So if you take this from a practical standpoint, each and every one of you, and what you're doing, you're probably interacting with 90+% less people on a daily basis than you did before this crisis. That gives the virus that much less opportunity to spread. And if we all do that, and if we continue to do it, what we'll see is that these curves will flatten and that we will eventually be able to get it in a downward trajectory and eventually start thinking about how we reopen our societies. If you think about Europe...
We're going to come back and talk more about that, the reopening, which is a really important point in some of the questions. But, we'll get to that in a minute for those of you online. But Steve, a lot has been made about, what kind of treatments are going to bend these curves too. Can you talk a little bit about that?
Yeah, so let's talk about treatments in three buckets. There are older drugs that are being repurposed for COVID. The ones you're hearing mostly are about the old malaria drugs of hydroxychloroquine and chloroquine. We actually have started a clinical trial. So there's a lot of trials going on out there where patients aren't being randomized. We actually have started a clinical trial randomizing people to one of 4 different treatment regimens. So we have a hydroxychloroquine arm, a hydroxychloroquine azithromycin, a chloroquine arm, and a chloroquine with azithromycin. We're doing this through Washington University. And so we're hoping that within a couple weeks, we'll actually know, do these drugs actually work? But even better, we would know what the optimal regimen is. Now, this is not the only trial. There's been several trials going on. The World Health Organization is looking at it as a preventative measure. You have trials going on both in New York and Seattle, so hopefully in the next couple of weeks we'll know. The second group of drugs are drugs specifically designed to take on COVID. This is the Gilead product, remdesivir, but also many others. There's now multiple remdesivir trials going on both in China, Asia, and in the United States. Those should read out in the next couple of weeks also. So that's an agent that specifically is given. But unlike the malarial drugs that are oral, this is an IV agent that's being reserved for the sickest patients in the hospital. And then there are other approaches like convalescent plasma, where we're taking the blood from patients who have recovered, taking the antibody component of that and infusing it into other patients. And that's an old technique that's been used for over 100 years. We're seeing some very positive early effects, but we're truly going to have to test it on hundreds and hundreds of patients before we can declare that as being useful. And then finally, there's vaccines. And you've heard a lot about vaccines. The science going into this is extraordinary. We've now seen vaccine development speed up to the point where from the time the sequence was published to the time where we started a trial was 42 days. And as you know, other companies like Johnson & Johnson are actually so positive on their candidates, they're actually starting to ramp up production even before they prove efficacy, with the hope that if they have an effective agent, they can get it out months earlier than normally would happen.
There's a question online about the Korean oxygen therapy that they've been, touting as a cure. Any opinion on that?
Yeah, so in Korea, it's been very interesting. They jumped on this really fast, and they were able to try a lot of different things. Remember, in Korea, it's been really small. That's a one little trial, and so that's going to need to be replicated. But it's very exciting to see what they've done. And there's a ton to be learned from our Asian colleagues about how they handled this crisis and how they're trying to open up society.
Yeah, and you hear about the clinical trials that need to happen and how many years that takes. And I think what you're saying is we don't have that amount of time. We've got a crisis at hand, and so we're trying all these experimental things that are hopefully low cost, that are accessible, that could be quick. And we'll follow on with the formal clinical trials later. But kudos to Cigna for jumping in and trying to experiment.
Well, the FDA has been phenomenal in trying to accelerate these things. The scientific community has risen to the challenge. I am a true believer we're going to innovate our way out of this. In America, we're not going to be able to do some of the draconian things they've done in some of the Asian countries as far as social distancing and truly locking down society. I am totally confident that in America, we will innovate our way through this.
Yeah, and so what do you do when this virus, we're hearing also that the virus has many strains and then it's mutating. What do we do with that? How do you keep up with this thing?
Yeah, so let's be very clear about what we talk about mutating. When you look at the DNA sequencing, so far we are not seeing mutations, and that's a good thing. Because as you know, if you create a vaccine, you want that vaccine to be effective if the virus changes. The presentation is changing, and so people talk sort of with loose language that there's a mutation, but so far, there's only been essentially 2 variants, and they're very close together, and they're not seeing mutations.
That's great.
Can I ask a question to Dr. Miller?
Please.
So, Dr. Miller, I think the medication issue is really interesting and very important. There is a stage before that, perhaps, or at least parallel, and that is the testing. And there's, of course, a lot of different types of tests coming around. And can you give us sort of an update on what you think are the most promising ways towards accelerating the testing?
Yeah, so great question. As you know, in the United States, we got off to a slow start in testing. And to be very frank with everyone on the call, we are still not where we need to be. If you think about how easy it is for you to access testing today, we just aren't there yet. And so we have more to go, but I will tell you that the major lab companies like Quest, LabCorp, and others are really stepping up to the challenge. We're able to do over 150,000 tests on a daily basis in the United States. And let me describe what we're talking about here. The testing we're talking about here is for the antigen. It's for the actual virus. And so this is the nasal swab people are using to see if you have the virus. The future testing we're going to need is what's called serologic testing. That's a blood test in which we look to see, have you developed antibodies? The market has been flooded with antibody tests that are of dubious effectiveness. And so we got to be very careful. The FDA has only approved one company so far for their antibody tests. So when your patients are actually getting these antibody tests today, it's unclear if it's actually truly measuring COVID-19. Remember, there's hundreds of coronaviruses. And if it cross-reacts with the coronaviruses you and I normally encounter, it doesn't mean you have immunity. So we have a long way to go when it comes to the serologic tests. The major lab companies are actually truly just weeks away from having certified tests. And so in the near future, we're going to have both the antigen test that tells you if you have presence of the virus and the serology test, which means if you're immune. And both of these in hand are going to make a huge difference in how we move forward.
That's great. Well, listen, let's we want to get the audience involved here today. We have multiple poll questions that we'd like to share with you. If you could go to the next slide, I'd like to introduce the first poll question, and this will be, again, available to all of our audience to respond to this thing. And the question here is, how has the COVID-19 virus impacted my company? Not at all, a little, somewhat, a lot, or devastatingly. Let's open up the poll for voting on that, and we've got hundreds and hundreds of people online today, so we'll give this a few minutes to populate here. But you know, you've got to believe that everything that we've read in terms of the economic impact and so forth, that the viruses have, I don't know, impacted everything and every company. But let's give it 5 more seconds. 5, 4, 3, 2, 1. Let's look at those results. Okay, it looks like the virus has impacted my company between somewhat and devastatingly. That is very interesting. Okay, one more question and then we're going to talk about it. Second question, put the next slide up, which is, how has the COVID-19 virus, move to the next slide, how has the COVID-19 virus impacted me personally? So the first one was, how has it impacted my company? The second one is, how has it affected me personally? And again, here we have the polls open. If everybody could vote. Has the virus affected us personally? Not at all, or a little, somewhat, a lot, and again, devastatingly. And we'll see how that goes. We'll hold this open while we talk about this. You know, everybody seems to know somebody who was impacted by this, and certainly everybody's company has been impacted. So let's hold the vote open just a little bit longer. 5, 4, 3, 2, 1, and let's close the poll. Let's show those results. Okay, so COVID-19 virus has impacted me personally. 15% say a little, 42% somewhat, 40% a lot. So somewhere between somewhat and a lot. And the good news is that only 2% say devastatingly, which I would assume to mean that loved ones or one of you has or some of you have had the virus yourself. So let's get some comment on this from our group today. Dr. Miller, what's your reaction to this?
Well, you know, I think that everyone in the near future is going to know someone who's actually been impacted by this. When you look at the percentage of the population that's being impacted, it's going to be significant. And when you talk about literally tens of thousands of deaths, most all of us are going to know someone who actually died from this. So I think that what we're seeing is this is the early phase where we've all been locked down for several weeks. As we move through this, it's going to probably feel even a little more painful for others.
Okay. Bart, comments?
Yeah, I think it's interesting to see that the personal question is a little bit more favorable. I think Dr. Miller is right that we're going to see worse effects coming because the number of deaths, unfortunately, are still continuing to increase for quite a while. But I think the optimistic interpretation of that result is that I think people are really doing everything to protect themselves, their loved ones, their families. And of course, we're all concerned about our business, but it starts with protecting our personal lives. And I think if people are a little bit more positive on that, we have a way out.
Yeah, and Lori, you're in charge of our public policy center. If you were making public policy in this country and you saw these results, what would you be thinking?
Well, Steve, I think the results make it really clear that everyone's been hit economically. And so the public policy response on the economic side, which is what we're seeing in terms of small business, unemployment numbers, but in terms of the public policy money, it's going into small businesses, big businesses, individuals, and you're going to see a lot more of that because the extent of the economic hit is really apparent. And needless to say, on the health side, we're going to see that increase, as Dr. Miller was saying, over time.
Yeah, it's interesting. I really hope that I was actually happy to see that the companies were more heavily hit than individuals, but we've got to believe that we haven't hit the peak, as Dr. Miller has said, and if that's the case, there are a lot more people that are going to be affected by this personally. Let's move to the. Sorry, go ahead.
I was going to say it's also an indicator that we need to do more on the public health side as well.
Exactly correct. Yeah, great comments. Let's move on to the next section, the next issue that we want to address today, and that's really how is the U.S. healthcare system performing in this period of time? And Dr. Miller, you're sitting right in the middle of this crisis. From your perspective, were we ready for this pandemic? And I know I'm talking the broadest part of the system, but was the government ready? Was the healthcare system ready? How have we done so far?
Yeah, so we've done, to be very frank, we have rallied to the cause. So the response has been extraordinary, but we were not ready. That is, we historically had done more to prepare for pandemics. And then because we hadn't seen one for quite a while, we had actually started defunding our public health sector. And so when you look at most public health departments that had to do track and trace early on, they weren't ready to do that. When you look at our strategic stockpiles of personal protective equipment, it had been depleted and not been restocked. And so we got off to a very slow start. And when you look at the supply chain trying to keep up with this, it is really stretched to the limits. And so the biggest concern for my colleagues is we just don't have enough personal protective equipment. And that need is not going to go away in the very near future. And so we're going to have to do a lot to make sure that we can protect our healthcare workers if we're going to be successful in combating this. So the healthcare system not only was not prepared, but we're also not prepared for the aftermath because we have got to have much better public health measures when we let people back out. And they're going to have to be able to do track and trace, and we still have not built that across 50 states.
Art, from an economic standpoint, were we ready?
Well, I'd say on the healthcare perspective, I think a key issue also is how we're dealing with the non-COVID cases. I mean, a major issue that we're sort of transferring resources so rapidly to fighting COVID that the question is, how can we deal with the non-COVID cases, and is the healthcare sector ready for that? And that's really important for when we're going to talk about the economic recovery, because the main worry, of course, is that, people may get sicker to non-COVID related cases. So Dr. Miller, I'm wondering what your view on that is. How can the healthcare sector balance these two needs?
Yeah, really interesting. So the great news is the healthcare sector has really responded to the non-COVID patients with telehealth, for instance. Telehealth was fledgling before this, and the ramping up of the telehealth by every system has been truly extraordinary. And when you look at total claims, what's really interesting is total claims for medical care always falls off during a disaster. This one, it's falling off dramatically. So we're seeing about 50% less numbers of claims because people, surprisingly, even for diseases that you think you have no control over, things like heart attacks, strokes, and things like that, actually happen in way lower numbers when you have a natural disaster. And we're seeing that here. And so the system has done a great job not only of moving the hospitals to be able to take care of COVID patients, but also helping get patients out of those hospitals into nursing homes and other extended care facilities. And so I have to really compliment care workers. They have rallied to the occasion, but we also got to remember, this is not a sprint. This is a marathon. We're going to have to be prepared to continue to do this for quite a while.
So one quick follow-up question, if I may. This is great what you're telling us. The other thing is to encourage people who are sick to issues not related to COVID to actually go and see their doctors. There seems to be a lot of reluctance for people to actually go because they're just worried if I go to the hospital or the ER or wherever, I may get sick.
Yeah, no, you're correct. And so one of the things is you want to be taking advantage of telehealth and calling your physicians. One of the things we've seen after prior disasters is that patients, for instance, with cancer will often present with later stages because they put it off. And we can probably accommodate all of that. So we need to use our telehealth systems. We need these patients to still be reaching out to their providers if we're going to keep our diabetics, our chronically ill patients healthy, but also take care of the COVID patients.
Lori Murray, from a public policy standpoint, how have we been doing?
Oh, well, I was just going to say, Dr. Miller, I find it very interesting that the emphasis you're putting on telehealth, because that was one of the first regulations that the FDA lifted, in emergency lifting of the regulation in order to make telehealth more accessible. And we see the states allowing doctors from out of state actually do telehealth within some states actually doing telehealth. And I was going to ask you in terms of the regulations, particularly on telehealth, but also the healthcare system is one of the most heavily regulated sectors, as you know. And one of the first and continuing things we're doing is lifting the restrictions and lifting the FDA regulations on construction and expansion of hospitals, hospital beds capacity. And if you could just address first on telehealth, whether you think that's a regulation that ought to stay lifted permanently, as well as an assessment of the effect of regulation overall in the sector and how we should be looking at it during the crisis and after.
Yeah, so you're exactly right. What has happened for telehealth with the lifting of the regulations so that we could actually use non-certified systems has been a great thing for patients. Obviously, there's going to have to be a balance in the end, but I think that when we return to a more normal circumstance, we have to take the lessons learned and we have to say, this has been great. And not only is it great now, but telehealth will permanently lower the cost of healthcare and provide great health. And so we need to make sure that we keep the regulations that are in place that will allow that to happen and that we don't slip back. The other thing that you brought up, for instance, is letting doctors practice across borders so that we can actually move that workforce in a dynamic way to where it's needed. That's always useful. And so having these regulations, right-sizing regulations is going to be crucial. We can't lose the learnings that we're getting from this episode.
Dr. Miller, there's a number of questions online here from our audience today. Let me just see if you can take a few of them. One of them is, how is the health of the system itself? I mean, financially, there were a lot of players that were on the ropes beforehand. Is there going to be a shakeout in the industry? Second is, how can we expect the pandemic to hit the health insurance consumer? And then, another thing is, how about healthcare expenditures in the next year or two? How is this going to impact the country? Maybe you could just comment on those and then get Bart and Lori to pitch in after that.
Yeah, so let's take this in buckets. So for our providers, this is actually pretty devastating. If you're a doctor right now, you're in one of two buckets. You're on the front line and you are overwhelmed. If you are not on the front line, so you're a provider, let's say an orthopedic surgeon, a plastic surgeon, gastroenterologist, or others, you actually may find yourself out of work right now because we're not wanting you to use that personal protective equipment. So we're sparing it for the people on the front lines, which means your practice is closed. And so many primary care practices and subspecialty practices are in dire straits because their expenses are still there. They want to pay their staff. They got to pay their rent, but they have no income coming up in. And so we as a healthcare company are trying to figure out how to support them. The administration is looking on how to support them because we can't afford to lose them through this episode. We need these physicians to be available to patients when we have a recovery. And so that's a really dire circumstance right now, which we at Cigna, but also HHS, CMS, other insurers are trying to figure out how do we support providers during this period of time. The second thing you asked is about the insurers. What we see is that America was actually better prepared in some ways. And if you look at our hospital capacity, we have been much better served. But that's because we are one of the few healthcare systems that is based on choice and isn't a single payer entity. The single payer entities like in Italy, Spain, elsewhere have really struggled under this. And so the problem is that when you lose employment, when you have a lot of uninsured, their healthcare often goes with that. And so we're going to have to figure out, is it expansion of Medicaid? Is it a special program? But we got to make sure people can still access healthcare during and after this crisis is over. And so the health insurers are going to see loss of membership, but they actually are doing everything they can at this point in time to serve those members well, to make sure their copays go down. And we're going to have to look to see how we make this affordable going forward.
I think the healthcare expenditure question is actually extremely interesting, because normally what you will see in a recession, as we're heading into, or we're in already, is that healthcare expenditures are going to come down because people are going less to see the doctor, they have to save on their budgets and so on. Now we have this kind of bifurcated situation that on the one hand, we're spending massive amounts of money on healthcare to fight this crisis. On the other hand, we have doctors' offices that are completely empty because nobody goes. So I think there's a huge disruption here over the next couple of months. And the question is, how can we rebalance this in a way and at the same time sort of get these healthcare expenditures back under control?
Yeah, Lori?
Yeah, Dr. Muller, your answer, last remarks actually open up this question or lead to this question about special enrollment periods and coverage for people who have lost their jobs, who did not have employers' insurance. Do you think we should be having special enrollment periods right now and reopening the exchanges?
Well, I think that's one option. I think the administration has to figure out how they want to handle this. And that's not the only option that's out there, but we're going to have to continue to come up with products that help people who've lost their jobs, because we're going to have a period of time where we're going to have increased unemployment. Hopefully that period of time is shorter than, as short as possible. But the reality is we're going to have more people without coverage, and we got to figure out how to do that, because these patients will continue to develop illnesses like they always have. It will be at a lower rate than it is, because that's what always happens after these periods, and that's what happens during a recession. But they're still going to have needs, and we're going to have to figure out how to cover them.
A couple more questions from online. The rise in telehealth is great, but what do we do with the marginalized populations who suffer from comorbidities and deal with that? Another question related to just the stats, the statistics around deaths, and whether we were capturing deaths at home rather than, in addition to deaths in the hospitals, and how are we going to deal with that?
Yeah, so one of the things that this has uncovered is disparity in healthcare like no other episode has, right? You're seeing in Chicago, for instance, 70% of the deaths so far have been in minorities. Remember that minorities have a higher burden of illness to begin with. They have more diabetes, hypertension, cardiovascular disease. And if you look at the very risk factors that lead you to death when you get infected with COVID, those are them. And so then when you add on top of it difficulty in accessing the healthcare system, that just compounds the situation. So when we look at deaths in New York, New Orleans, Detroit, Chicago, we're really seeing a disproportionate impact to the minority community, and we're going to really have to figure out how to close those gaps.
Yeah. Great comments. I think we need to move on now and move to the next section of our discussion, and that's the question of what are the best and worst cases that we're seeing from an economic projection. If you move to the next slide, I'd like to turn it over to Bart Van Ark and to talk about the economists' projections here on what could happen in the United States. I think it's slide 11. Yeah.
Thank you, Steve. I think we're on slide 14. That's the slide. Thank you so much. Yeah, so let's try and make this transition. When we talk about the economic and business impacts, there are two things that we need to talk about. One is what we talked about very extensively, and Dr. Miller, thank you for your great comments here. That's what's happening to the evolution of this COVID-19 crisis. And we have to make assumptions about what might be happening here and what not. The other part is how do governments and businesses respond in terms of, in the middle of the crisis, these stringency measures, social distancing and all lockdowns and any other things that are happening, but then also how are we going to gradually sort of relax this? This chart here is a very interesting way of Oxford University to basically look at a range of measures related to school closings, to workplace closings, to cancellation of public events, closure of public transport, restrictions of internal and international movements of people. And if you look at that chart, I all aggregated that together for the world, you see sort of 3 points here. First of all, of course, late January, when the Chinese government was beginning to impose lockdowns and other contingent measures across China. Then in late February, early March, you see another increase because Europe was beginning to accelerate its measures. And then you see, and then later on, of course, the US, and then the last couple of, last week or 10 days, you see the curve flattening off a little bit because China is beginning to relax some of these measures. But still, it means that, over 70% of the global economy is one or another way under these very stringent measures. And the question now is, what are these going to do and how are these going to be relaxed? So if we go to the next slide, what we've done at the conference board is instead of thinking about a whole range of very different, thinking about one forecast, we basically developed sort of 4 different scenarios. And I just want to quickly go through those and really ask Dr. Miller sort of see which ones make most sense from a health perspective. So the first one is basically what we call a reboot scenario or a quick recovery scenario. This is actually becoming increasingly unlikely. Frankly, it would basically mean that we are passing the peak now and that we would be able to very quickly begin to accelerate and open up the economy. This is, of course, very tricky because there's a real risk that we're doing this too early. And if we do that too early, then, of course, the quick recovery will not happen. We'll actually get a very quick resurgence of cases. The second one is the one that economists mostly talk about, and that this is a very deep contraction. We already seen an unusually rapid contraction during March. That's continuing into April. The deeper a contraction, the more of a recovery you will get. That's almost an economic law. But the question is whether that recovery is V-shaped, very sharp in Q3, or whether we're going to be more cautious in opening up the economy and it becomes more like a U-shaped type scenario. Of course, if we open up too fast, the risk is that we're going to get a resurgence of cases later on. And as a result of that, we're beginning to see a decline later on in the year. The best option probably is where you can balance the health perspective and the economic perspective is to basically slowly begin to open up the economy. This would frankly be done by a kind of U-curve recovery. So it's not a V, it's just a very slow opening of the economy. You flatten the curve, as Dr. Miller talked about earlier. You have more economic pain in Q2 and Q3, but the upside is that you will have more certainty about the recovery later in the year. If you go to slide number 16, you can see that any of these economic impacts on GDP are going to be negative. Even in the most optimistic scenario, which I think is out of the window, we would already see a contraction of 3.6% in the economy, 220 over 219. Any of the other scenarios will give us something like 6.5%, or if we get in this W, which is the red line, you would even see a 7.5% decline in the economy. So if we go to the next slide, of course, the impacts by sector, and that's where I want to go back to the healthcare sector implications, are of course quite different. At the moment, it's these social distancing measures that really impact entertainment and recreation and restaurants and accommodation. But of course, the longer the crisis is going to last, the more sectors going to drag into this. On the other hand, there are some upsides. We talked about the healthcare sector. On the one hand, the healthcare sector may see some upsides. On the other hand, particularly when it comes to more expanding on fighting the crisis, on the other hand, we will see a significant pain in other sectors of the healthcare sector where they cannot continue to grow related to non-COVID cases. So I think the question really is what scenario is the best balance between the way we're trying to fight the COVID crisis, protect people's health, and on the other hand, gradually begin to recover the economy. So I think my question to Dr. Miller and also to the others on this call is, do you think this U-curve scenario is feasible. Can we do it? Can we keep social distancing in place for another 4 or 6 weeks or even 2 months or more, and at the same time gradually start up the economy? I think that's the big $64 million question we have to try to resolve.
Yeah, Bart, that's actually really fascinating how you look at it. If you think about it from a healthcare perspective, we look also at 3 potential scenarios. So let me give you the most optimistic scenario. The most optimistic scenario is that people continue to do great social distancing, that we actually have a change in weather that makes a difference. Now remember, that is totally unproven, but has been seen in many other respiratory viruses, and that you actually have introduction of therapeutic agents that make it so that this isn't nearly as deadly. If that happens, what you would see is that over the next couple of months, you'd be able to start relaxing restrictions. The economy would be able to return to some of the economy would be able to return to its pre-COVID activity, and that you would not get to normal until you have not only a vaccine available, but a huge percentage of the population vaccinated, so you had herd immunity. The second option is that this continues to burn through the summer, so you continue to have social distancing. We don't see an impact of weather. We don't have a therapeutic agent, and the only thing that helps us is social distancing. And if that's true, then we continue to limp along until a vaccine becomes available. And then finally is, if it continues to be just really hot, that is, we as Americans aren't good at social distancing, we start letting down our guard, more and more people get out, and we continue to have high numbers, and those numbers not only are in New York, New Jersey, and New Orleans, but they start spreading to other major metropolitan areas, and that the economy continues to really suffer through that period of time. And so those are the 3 scenarios we look at. And as you can see, each of them would have a direct economic impact tied to it.
Yeah, this might be a good time to introduce the next poll question, if you could put that up on the screen. And, the question here is, what's the right balance between assuring that the virus is contained and getting the economy restarted? If you could put up the poll, we will we'll look for a vote on that. Luke? There we go. You should see a poll question on your screen now. What's the right balance between assuring that the virus is contained and getting the economy restarted? And 4 options here. Keep the economy closed for as long as it takes. Second, open the economy when there are no more new cases. Third, open the economy when the curve begins to flatten, or open the economy right now. Let's open it up for your vote, and we'll see if we can leave this up here a little longer. But I think, the public policy aspects of this are going to be, driven by people's points of view on this exact question. We'll see where we come from. I can't see the voting, so you'll have to just let us know, Luke, when you've got enough votes in, and then just switch to show us the outcome so that we can share the results with everybody here. So the question is, how do you open this back up? Because you shut it off with a light switch, but it doesn't necessarily come on that way, and so forth. Let's see if we can share the results, Luke, if you put those up on the screen, please. Keep the economy closed for as long as it takes is about 1/5 of you, and then 40% split between open it when there's no new cases and open it when there is a flattening of the curve. So, key question for the panelists. Lori, when do we reopen the economy? Well, how do these policymakers make this decision?
So I was going to say the public policy is absolutely central and critical here to opening the economy, because what you're seeing is you've got to deal with the public health issue, and you have to deal with the public health issue. You have to deal with supplies. You have to deal with protective equipment. In order to even open the economy, in order to flatten that curve and open the economy. I do want to say, though, that there's really, I think, good news about democracy in all of this. And the first is in terms of the estimates getting lower from the University of Washington. And Dr. Miller, tell me if I'm right about this, but part of the reason why those estimates have improved is because we're getting data from the democracies in Europe, where, as well as Asia, where we were assuming that we wouldn't be able to have the same types of social distancing and controls, or enough social distancing controls in a democracy. And so the estimates were higher based off of the fact that we wouldn't be able to mirror China. And the fact that, across America, we are actually responding to and listening to the things we need to do is actually helping to flatten the curve. The other good thing about democracy is we're watching Congress and the president come together and in ways that we haven't seen in years now. And I think this is very encouraging, and it shows that despite the political divide, we are actually moving in very, very positive directions and historic directions in terms of our public policy.
Yeah, Dr. Miller, from your perspective, and one of the questions online is, what does open the economy mean? It's because it's a very wide range thing. Do you roll back? Do you start geographically? Do you start by sector or so forth? But from Dr. Miller, from your standpoint, how do you make the decision here of when to begin to open things back up?
Yeah, and let me give you some insights from what we've learned from our Asian colleagues also. So when you open your economy, it's going to be gradual, and you're going to have a couple things. One is you're going to have patients that are recovered. Those patients most likely will not be able to get the infection again, and so they'll be able to go out and start working. And when you think about that, that may be up to 10, 15% of our population will actually be free of having to worry about the disease. That's going to require a serologic test to help us get there. And so that's what links back to what we talked about earlier. The second is you're going to want people going back to work who are essential first. And you're going to want to change the work conditions such that you have more social distancing even within the facilities to make sure that they're safer within those facilities. Remember that this is actually going to be really controversial. If you look at Sweden, Sweden did something that's totally different than many other countries. They did what's called reverse isolation. They just sequestered their vulnerable populations, their elderly and their sick. And their course has been actually fairly similar to Germany and others. They've had a fairly mild case of this, and they're going to have more herd immunity than almost any other country when they get to the other side of this. So we have a lot of questions ahead of us on how to do this, and we have a lot of examples from around the world. The one other thing I'll say is that when you look at places like Singapore, when you come into Singapore, they actually put a GPS band on you, and they watch where you are for the first 14 days to make sure you quarantine. And remember, when we open up our economy, we're also talking about opening up travel, and we got to figure out how we're going to do this. In China, you are required to download an app that has a red, green, and yellow light that essentially tells you where you are allowed to travel. We're probably not going to do things like that in the United States, but we're going to have to come up with our own solution that works in a democracy that gets this economy working again.
Yeah, and this is really a key question here. And let's just move through to the next discussion, which is what should be the future public policy actions on this? Lori, why don't you start us off, and what should governments do?
So in order to figure out what we should do, I just want to quickly say what we have done. And it's been historic what we've actually been doing in the United States in terms of the size of these packages. In terms of how much money we have actually already legislated in these bills, it's twice the amount in terms of GDP. It's 10% of GDP as opposed to about 5.5% of GDP during the Great Recession. And it's historic what the Federal Reserve is doing in terms of liquidity. And it's historic actually in terms of the executive branch moving out with January 31st with Health and Human Services first declaring a public health emergency, the president stopping travel to China, from China, March 11th, stopping travel from Europe after the pandemic was announced by the WHO. And then, of course, the national emergency declaration in March 13th, which led to opening up of $500 billion. You then had $8.3 billion appropriated by Congress to deal with the health aspects. On the 6th, you had $200 billion appropriated by Congress on March 18th. And then, of course, you had the $2 trillion CARES Act, and which really went at 7 major sectors, giving money to individuals, small businesses, big corporations, public health, state and local governments, education, and then, of course, the safety net and food assistance. And you have phase 4, where we are saying we need to do much more. And then we're not only saying it, but it's really obvious in terms of the hit on all these aspects of the economy and on individuals' lives that we need to do much more. But my question to Dr. Miller in terms of any of what do we need to do going forward, and there are two critical questions. And one is we can't, any scenario for opening the economy means we have to have supplies of PPE, not only what we're talking about now in terms of the healthcare sector, first responders, but if you're actually going to open businesses, you might not need masks of the same grade and level, but we're talking about using masks in the office place, gloves. We're talking about testing, which is absolutely critical, more extensive testing. And as you were mentioning, Dr. Miller, we've really fallen short on the testing we have done and the testing we need to do. And so having the testing equipment, as well as being able to assess those tests on a scale where people would feel comfortable going back into the office place. And we've seen this happening in Asia, and as you were mentioning, some of the more serious types of constraints that they're putting on movement. You really need to build out a health infrastructure that we just don't have right now. How long will that take, and how much money will it take? And then, of course, the critical question that everyone is focusing on in terms of the executive branch, should we have a more aggressive and comprehensive use of the Defense Production Act?
Yeah, a lot of questions there. A lot of them I'm not qualified to answer, obviously, but I'll refer people to a couple things. Both Scott Gottlieb and Mark McClellan, 2 former heads of the FDA, have actually put out 2 papers, one by the American Enterprise Institute, the other by the Duke Margolis group. And they look at how you reopen the economy and things we need to build to put in place. And I think it's a great blueprint. We've been working closely with both because we believe that we have to start thinking about these things now. We talked a little bit about we're going to need to have better public health so we can do track and trace, because when we get this down to a few number of new cases each day, we need to be able to quickly identify those cases, identify their contacts, and get them into isolation to keep this suppressed.
And you need the facility.
So building those things out, making sure our healthcare systems can make it through this period of time, making sure that we can take care of our first responders and others. And so we got a lot of building out to do. And so I think one of the things that's going to happen is the government's done a phenomenal job, as you've pointed out, to rapidly rise to the occasion. We're probably going to have to take a deep breath and say, okay, now, how do we actually get much more systematic about how we build a public health care infrastructure that's going to make sure that Americans are safe, not just now, but going forward?
Bart?
I think, the whole issue about public policy, it actually goes back to the question we just asked. So 39% of people are saying we want to open up the economy as soon as new cases are going to come down. Others are saying, out of 39%, we have to wait until all new cases are gone. That's a very stark distinction. And obviously, we would want to do the first. We want to get the economy going as quickly as possible. However, we can only do it if we coordinate, collaborate, and if there's trust. So I think the real issue on the public policy side is whether we can work on a trust base, whether people trust their governments, whether governments work together, federal versus state, and states among themselves, whether businesses are willing to work together with local governments, and so on and so forth. And I think the real question is whether we can do that. There are some countries where the trust among governments is bigger than in other countries. And I think that's going to be the critical measure. If the trust is not there, if the collaboration cannot be established, we will have to wait until all new cases are gone, because otherwise we're even in a deeper hole. So to me, that's sort of a key issue we need to look at. Can we collaborate?
Yeah, excellent points. I want to ask each of our respondents to address this question briefly here at the end of our webcast. And that is, how will this whole experience, I mean, it's hard to do when you're sitting in the middle of it, but how do you think this whole experience with this pandemic will alter our way of life permanently going forward. And Lori, I'd like to start with you, and then Bart Van Ark, and then Dr. Miller, briefly.
So I actually think that on three different levels, in terms of governance, I think the cooperation that we've been seeing and the closing of the divide in Congress and with the executive branch and the president, I think is something that will carry forward, because I don't think this crisis is going away anytime soon in terms of the need for public policy response. So on a governance level, I think we will see large benefits. In terms of the economic divide, I think unfortunately this crisis is actually going to deepen the divide economically in the country. And Dr. Miller, you were mentioning the impact of the disease disproportionately. I think the a digital divide is also going to become much more we're become much more starkly aware of the digital divide and how important it is to close that divide in an economy as it's ramping up over time that is very dependent on digital capacity and broadband. And but I think in terms of how it is going to affect how we conduct our lives and how we do our lives, I actually think we have catapulted into the future, and that we are going to use all of these new technologies and actually embrace them as opposed to be afraid of them. On my most positive note, I think we're going to accelerate in terms of our ability to progress as a nation and as an economy much faster had this not happened.
Bart, 30 seconds.
Yeah, it's a tricky one. I mean, if the economic divide is there, forget about political collaboration. So we have to look at these things really together in going forward. And going back to my earlier point, collaboration is critical. If we do that, I think the world looks very different after this crisis. If we don't, we just have to hope and pray that we're lucky and that we just get through this, that we muddle through. But I don't think the world will look very different there. So we have a really stark choice ahead of us.
Dr. Miller, last word. How will this experience alter our way of life for the future?
Well, I think that we actually have the economic consequences are yet to be felt. And so I think you're going to actually see the healthcare consequences first. The economic consequences will follow that. And then I think in the long term, I'm an optimist. I think we're going to have a more resilient country as a consequence of this in a couple of years from now.
That's great. Well, I'd like to thank Dr. Stephen Miller and Cigna for all that you do. And thanks to Drs. Bart Van Ark and Lori Esposito Murray, who have joined us today. If you want to hear more about Beyond COVID-19, check your email for future webcasts. And finally, you can explore all the resources from the Conference Board on our website at conference-board.org/COVID-19. Thank you for joining us today. I'm Steve Odland, the CEO of the Conference Board.